Okay. Hi, everybody. You're back today with Make Shit Happen. And I have got a lady on today's program. She is Dr. Karen Hoffman. She certainly has made shit happen in the veterinary world. Um, she grew up in Oxford Circle, Philadelphia. And some of Dr. Hoffman's earliest memories included playing with her grandfather's dogs. Her desire to own a pet was so great that when she lost a tooth, she'd leave the tooth fairy a note to not leave her any money, but to leave her a pet, which is unbelievable. When I think about that, a child saying, "Don't leave me money, leave me a pet who I have to take care of," is phenomenal. So it doesn't surprise me that you are a well known vet in your area. So over the years, Dr. Hoffman has developed many memories, notably veterinary memories. She has changed things for pain management for animals, something that we don't think about. We don't think that animals suffer pain, but this is one area that she does focus on. She had a tragic event happen which really turned her life around and many lives of animals. Karen, tell us about that tragic event.
Okay, so I was planning to become a human medical doctor, and I had my first dog, a standard poodle, and this dog was running in the yard when it was 2 years old, and he shrieked out and he was paralyzed on his hind legs. So at the time, this is in the 80s, rushed him to the University of Pennsylvania's emergency clinic, and they took him to surgery, and they found that it was a disc problem, but that something they could not repair. And so they told me I had to let him go at the age of 2 because he would never walk or control his urination or defecation again. So totally on a whim, because of this experience, I applied to 2 veterinary schools, never ever planning to go. And I was accepted into both of them right away, one of which was the University of Pennsylvania, where I did start going instead of human medicine.
Oh, wow. I don't, quite frankly, personally, I love animals. I've always had animals. I speak to animals. I am probably better with animals than I am with humans. Humans seem to irritate me. Animals I can spend a lot of time with. But when they're in pain, I just absolutely shut down. So when I listen to you and some of your stories about dentistry with I got goosebumps now thinking about animals in pain. Yeah. And I know, Patty, you know Dr. Hoffman personally, so tell us a little bit about your connection and some of the subject matter for today.
Well, what's really great is we started to talk about this a couple of months ago, I think, really. So Karen and I are first cousins. Our mothers are sisters. So, we've seen each other's path since we were little kids, really. We were always pretty close. I have only brothers, she has only sisters. So we really, and we're close in age. So we were really pretty close. And I think that when we started to talk about doing this idea, I thought, I didn't realize I was going to learn as much as I have learned. I would say that I'm not necessarily, I grew up with pets. We always had pets. My brothers have cats and dogs and birds. I always have had them. I have not necessarily had that experience. I think mostly because I've really been mobile most of my life, and I haven't really stayed in one place. And I never thought it was really fair to do that. Yeah. But I think that because I have watched Karen in her career work so hard, so diligently, with such great care, she goes above and beyond the call for the entire time she's been a vet, really. So in my family, we've always known that, but I think now I've really learned so much more about just veterinary medicine in the world and in the US. I also think that this is important because, people have pets, and sometimes for many people, it's the only relationship they have. And they're lifelong relationships. I mean, they can be together for years and years. So I think, paying attention to your pet's health, making them we don't think about it. Make them feel
No.
better.
Yeah.
What little things can you do to make them have, a healthier life? And what's interesting is that, I now have neighbors who have been telling us about different things with their animals. And I immediately say to them things like, well, have you had their teeth checked? And I would not have ever done that if it wasn't for knowing, what Karen, Dr. Hoffman does. So that's sort of where I came to this. And then I thought we could cover just a few topics that would be of interest, So we kind of came up with behavioral issues, cruelty to animals. What's the way to train, some kind of behaviors in whatever animal, dogs, cats, whatever. I also thought that COVID would be an interesting topic because now we're sort of in a way coming out of it. But, you had a lot of people who stayed home for a long time. So are their pets having separation anxiety? That's probably a real thing, basically. The other thing I didn't know much about at all is the work environment for vets. And the statistics are not great. It's an incredibly difficult field that you have to be completely committed to. And it's difficult. And I never really thought about it like that. And then I think too, to talk a little bit about just the health and food. We had an interesting conversation, three of us, a couple of weeks ago, and we were really talking about things I didn't even think about, but really those little things. If you think about as a human, if you have a toothache or an eye, like that can, it's just terrible. So imagine an animal who really can't even tell you that. Right. So those are some of the things I thought we would sort of walk through today.
Well, I will tell you that when Patty suggested that we have you on the air, Dr. Hoffman, as a veterinarian, I thought, well, what can we discuss? It's, it didn't seem to be all that inspiring and energetic for me. But then we met you, and I'm going, yeah, this is exactly it. It is a subject that I think is not talked about enough. And that's why we have so many animals that are in shelters that are not getting the care that they need. Why? I question, why should we have pet walkers? Can you not take your own dog for a walk if you're going to get a dog? So, these are things I know that we're going to discuss. So I want to give it up to you, Dr. Hoffman, to teach us how to care for our animals better.
So let's start with the behavior issues that we talked about the difference between positive reinforcement and negative reinforcement. So
great. So there is a wonderful website or a source of information called Fear Free Pets, and it's started by Dr. Marty Becker in 2016 after a very well-known, phenomenal veterinary behavioralist named Dr. Sophia Yin killed herself. And first, we now know that your animals want to please you. They're not deliberately saying, I'm going to be bad today. And everything is that you just need to figure out the right way to tell them what you want. And that should be done by positive reinforcement. It's wrong to think, I have clients say, I came in the house and the dog had urinated and he knew he did something wrong because he had his tail down and he was looking at me. And I try to explain to them that is not the case at all. The dog is reading cues off of you and knows you're upset, but has no idea that it's because he urinated on the carpet or whatever. And in practice, I frequently see clients come in with prong collars on their dogs, which are very dangerous, and it's a negative reinforcer. They go to different trainers that use collars that are shock collars, and these trainers tell the owners that this is a very minor shock and it won't do anything. But all of that is not the way things should be done. And as far as COVID and separation anxiety, this is a real problem right now because owners have been home with their dogs. Dogs are social creatures. They want them home. And now they're starting to leave for work. And if they put them in a crate and the dog is not crate trained, the dog can really hurt themselves. I actually saw a dog break its jaw once. They need to have the right tools to desensitize their pet to them leaving. There's different behavior modification exercises they can do. There's different natural products that, like, for example, there's dog appeasing pheromone that they could get a collar and put on him. It's what they smell when they're suckling, and so it's calming. They just can't get angry and leave the pet there. There's resources for free videotaping of your pet when you leave the house, what your pet does. Frequently, we need to use medications, and a lot of clients aren't open to that. But if they see what their pet does on the video and realizes that it is a major panic attack, which happens right away, hopefully they will be more open to this medication if it's needed. A lot of people balk at medication. So
can I ask you something while it's in my mind?
Yeah.
Do you believe in crates? I mean, I don't.
Yes. No, the only time I've used crates is when I've had puppies, and when they're young, less than 6 months, and I have to leave the house for a few hours, and I can't trust them yet not to harm themselves. But by the time all of my dogs are 6 months, they never go in the crate again. There's no crate in my house. They're free. And I also, we do not leave our dogs ever for more than like 4 to 5 hours at the most, so that someone comes home when they're puppies, takes them out, plays with them, feeds them. Maybe they'd go back in till 4 and then they're out for the rest of the night and the day. They're out all weekend. But I know that behavioralists for fearful animals like the pet to not be afraid of a crate and to think of it as their safe place to get away from children who might be running around after them, or guests when they have fearful anxieties to strangers. A lot of dogs who are very nervous will willingly go and, hang out in their crate to get away from outside stressors if they're that type of nature.
Right. So, I mean, really,
they're on little timeout, kind of. Yeah.
Yes, a timeout. Mm-hmm.
Like self-imposed. Yeah.
Self-imposed timeout. Yeah.
Yeah.
Mm-hmm.
Okay. Yeah. You know what's interesting?
I'm not a crate person. I always arrange, again, I only do it when they're young. It's like leaving your 2-year-old wandering around the house with no one watching them. They can get into trouble. Yeah.
Right. It's also interesting because we tend to put human emotions to everything. Like, so when you said about, the dog doesn't know your human emotions, so you got to sort of get rid of that. Right. And not necessarily behave that way because they don't really understand, you're right. There are signals.
No idea.
Exactly. Right. Which is interesting. I kind of thought about that, but I'm really thinking about that more now. Yeah.
And one thing the behavioralist taught me, which I thought was interesting, and I use it as an example to clients, are that when people are training their dog to urinate or defecate outside, many of them give them a treat when they come back inside. And they think that they're reinforcing the positiveness of going outside. However, that's just telling the dog, ooh, it's good to come inside, I get a treat. Has no reflection on what they did. So you have to be there at the minute they do it and praise them and give them the treat right then. So it's kind of funny to see how just a little change of a minute or two makes what they think's happening very different.
Yeah. Well, I just learned a lesson because when I take Zim for a walk, I always have treats with me because we join the traffic, and when we come to a stop sign, he actually sits and I obviously give him a treat, and then we look at the traffic and we cry. But what I do, which now I won't do, is when I get home and we get inside, I go, that was a good walk. Here's a treat.
Yeah.
He probably
Right,
goes,
right.
oh, I'm home.
Yeah.
Here's a treat.
Yeah.
Right.
It's good
So-
to get home is what he's thinking. Yeah. But-
As we're talking about different COVID things, so do you think that COVID has changed the client vet, patient animal relationship? And will that, it's been difficult, right? I think during the last 2 years. So how do you see that?
It definitely has changed it. During the actual, up until very recently, actually, clients had to wait in the car and their pets would come in to limit exposure to the staff, et cetera. And a lot of clients did not like that. And also there were much longer wait times. And so people became very aggressive and not very nice. And we actually had to put up signs outside saying, please be nice to the veterinary staff, which is pretty incredible. That never happened prior to COVID, although there are people like that. But so it did create a very tense atmosphere, because of course the clients are going through their own problems with COVID. And it affected the veterinary profession in that, like, students in veterinary schools that don't have a hospital and need to do externships to graduate weren't able to because the vet hospital didn't want to accept an outsider with potential COVID exposure. And they also eliminated elective surgical procedures, which would be like spays and neuters. So when COVID was finally letting up, then there was this long line of dogs and cats to be spayed and neutered. So our hospital had like a few days of just doing that to try to get caught up. But the most important thing is that it has affected emergency rooms around the country. There are fewer of them. They're harder to be staffed. The wait time is frequently many hours, which is not good for the client and not good for a fearful pet inside. And so the other thing is the financial burden, which I tell every client, and if anybody listens to this, please investigate pet insurance. The cost of things are over the roof. And there's nothing worse, I think, for a person to have to say, I can't afford to treat my pet when there is a treatment available, so I have to let them go. I mean, that's a horrible decision. But
yeah, you bring up something that, I applaud my daughter for doing, and that's getting pet insurance, because unfortunately with Zimbabwe, we were told, and it appears as though he was neutered, and in fact he was not. His testicles are inside his stomach and his groin. Right. So she's now having to go through the surgeries, which is up to $8,000.
Right.
Got insurance, which and insurance also pays for prescribed food as well. Right. So guys listening out there, do it, because what you're doing is you're helping the vets as well.
Right.
Yeah. And that is really one of the most important things to take home from this, because on a daily basis, people are shocked at the cost. And what they don't realize is that in human medicine, with their insurance, they're picking up most of the bill. So they're paying a $20 copay. So when they get a bill for their pet, that's way higher than that. Yeah. They're like shocked. And
and if you're a human and you don't have insurance, you don't say to your child, oh, I don't have insurance, you got to go.
Right, exactly.
Got to get rid of you.
Right.
Well, I think this is a good segue into one of the things we really sort of talked about and want to talk about here is work environment. And Karen, you had said that, which is interesting, you're euthanizing animals that really you don't have another option to. I mean, I think you probably only would do that when you think there really truly is no other option, basically. Right. But that really can take a toll on vets, I think. And that really sort of was astounding to me, because I thought, wow, that's, good gosh, that's really hard, a tough thing to see, even if you do it once a week or twice. I mean, that's really difficult. And then what you had said to us, which was amazing, is that vets are the number one suicides in the medical, profession. And so I went back and read a little, and it was like, wow, it is really shocking and astounding, but it is. I think, some of the things you shared with us, the expense to become a vet, which can be just insurmountable. You come out of vet school, especially if you go to a great vet school, I guess, you come out with, hundreds of thousands of dollars worth of debt. You're paid not that well. You're expected to work amazing hours, have incredible empathy. I mean, the list goes on and on and on. So, I think that's something that, the public needs to understand too, and they don't really.
Right. Yeah. It's an incredibly intense profession. It starts with, like you said, sometimes there are pets that, and thank you God, this does not happen to me often at all, or if ever, because I don't do emergency for this reason in particular. But if a client can't afford treatment and it's a very bad problem, then they have to choose the alternative. There are also clients that keep their pets alive well past a good quality of life. Mm-hmm. And I can remember a human gerontologist, that's a doctor for old people, who had this dog that he refused to euthanize. He didn't believe in humane euthanasia. And this dog couldn't see, couldn't hear, it never went out. It was a little Maltese, stepped on its poop. Its feet were always caked with poop. It was barely eating. It would circle, and he would come in. It was skin over bones. And no matter what I said to him, he would just ignore it and say, oh, yeah, okay, all right, bye, see you next week again. And it was like, oh my God. So you see that. So, people think that we just get to play with pets, but we don't. And we'll get into dental disease later, but just this past week, I met a lovely woman and this adorable little dog who had very bad disease. She's going to need many teeth pulled. And she also had a heart murmur, and her heart is slightly enlarged. And the woman declined having a cardiac consult. And then the woman said to me, my teenage daughter is against this procedure because this was a gift from her father, who is dead. And this dog means everything to her. And, you get that on you and you're like, oh, dear God, I'll be doing this procedure and the dog's going to be a lot better. But I mean, it's just these kind of things that are dumped on you mentally that take a toll every single day, multiple times a day.
Mm-hmm. And then, it's not the animal that's bringing this on you. It's the humans.
It is the human. Yeah. So, and they always think that veterinarians are wealthy, and that a big thing, and this is very hard on a vet, someone might come and say, well, I can't afford the treatment on my pet, but you're a vet and you should do it because you love animals. And that is like, again, the hardest thing. Another reason I'm not in emergency medicine, but if a dog ate a ball and for $7,000, you could remove the ball and this 1-year-old dog would be healthy, but you say to them, you don't have money, I can't do the procedure. I mean, can you imagine that? No. There's no way to win in this situation.
Really difficult. Well, yeah. I think two of the interesting statistics that I saw were that 88% of graduating vets in the last 10 years are in extreme debt, basically. Right. And it can take multiple jobs for them to be able to afford anything. Right. The thing is, the last 10 years, if you, polling certain vets, I guess, 82% said they actually regret becoming a vet. That they love it, they've loved it forever, that this is something they wanted to do, but they do have some regret because of some of the things you just really talked about, basically. So, those are interesting statistics that we don't really think about so much. You know what I mean? We just don't. I don't think a lot of people do, but this is sort of enlightening. I think this is why this was another good topic for us, because it is
Right.
enlightening.
Yeah.
I also
Yeah.
want to I want to circle back to the whole sort of like food, dental care, because I know that you specialize in some of those things. So like, what is one of the first things do you look at the teeth right away? I mean, how do you do that? Why do you do that, or how do you do that?
As part of my physical, I always, look at the teeth. And then what I find helpful is I take photos on my iPhone of the teeth that are diseased, and then I show it to the people, because people don't look in the mouths. And I want to prove to them that I'm really seeing something that isn't good. And people never, ever believe their pets are in pain. I tell them, your dog, your cat is in a lot of pain. It's got to hurt. They say, well, they're still eating. They're not showing me pain. And I try to explain that that's instinct. You don't show the pack that you're sickly. They'll leave you, or the predator will get you. And they don't know that if they tell their owner, hey, I have mouth pain, something can be done about it. So they just eat no matter what. And actually, on Mount Laurel Animal Hospital's website, there is a lecture on periodontal disease. And in it, I have a client who had her dog's teeth done, and she came back for her recheck to see that everything healed. And she just went off on how different her dog was, behaviors the pet was doing that it had stopped.
Sure.
And I asked her if I could tape her to be on this, and she said yes. So I really believe in this. But then again, you have her client, like, to do it safe, and I do very old animals with heart disease, with comorbidities, you need to do blood work. You need to have IV fluid support. You need to have very good technicians trained in anesthesia with monitoring of blood pressure. If the blood pressure is low, let's give this medication to bring it up. We have to have good pain control. We use local anesthesia, pain before, pain after. They're lengthy procedures. They're working in a very small space. Many things can go wrong if you're not trained well. For example, one of the tooth most likely to fracture, the carnassial in the back of the mouth, well, right under that's the eyeball. So if you slip with your dental instrument while you're in the mouth, right. So you really have to be trained. You have to have a good staff. You have to do good monitoring. And that costs money. So when I tell a client it's $2,000 to do their pet's dental and take out many teeth, they're like, I have a vet down the road who will do it for $300, or it doesn't cost that much with my dentist. But they're negating all these other things. And for any vet who says I can do it for $300 or $400, they're not doing blood work, IV fluids, support. They're, this is like throw it in there and hope you make it.
Like tie a string around the tooth and shut the door, basically, right? That's exactly. Yeah. It's complicated. It's really complicated.
It really is. It is. And one important thing is that dogs' enamel is half the thickness of human enamel. So anything really hard can break the tooth. And so I always try to counsel people not to give very hard things to chew. And also for cat owners, cats, their own body digests their teeth. They're called resorptive lesions. And I try to teach cat owners how to look at that, look for it. If you run your finger over one, your cat will chatter. But I see cats and dogs with the worst disease. We would just die, and they're existing, and the clients are oblivious to this or reluctant to spend the money.
Right. So I want to jump to food, because I think that's really important too. Like what feeding your, all the different topics of feeding. So, people who make their dogs food, like human food, that's not really the thing to be doing.
Right. Well, if it is approved by a veterinary nutritionist, a homemade diet that you can buy commercially, that is okay. But there are not many like that. And they are very expensive, almost prohibitive for large dogs and all. But yeah, there's different ways. Like dogs are omnivores, so they are meant to have protein, fat, and carbs. And years ago, there became a movement in the pet industry to have grain-free pet food. It costs more money, and they touted it as better for the dogs. Well, in reality, about 5 years ago, they started to see more and more dogs were having heart muscle disease called cardiomyopathy, and they were dying, breeds that don't normally get it, and they all tied back to they were eating grain-free food. And they're not sure of what it is. It possibly has something to do with legumes, but now we actively tell clients, please don't feed grain-free. And for cats, cats are obligate carnivores. They need protein and fat. They never, ever, ever need a carb. So they can eat bacon, pork fat, any meat, any whatever, and that's better for them. Dry cat food, which doesn't smell, is convenient for the owner, is actually not as good for them as wet food. And it has nothing to do with the teeth. I see cats that just eat dry food that have terrible teeth. So I try to steal, there are websites to send owners to that have listings of the amount of protein, fat, and carb in canned diets, commercial. And there are ones that are better, like pâtés are better over gravies because gravies have corn gluten in it. So, and this one website, tells you how to try to get your dry food addict onto wet food, because whatever a cat starts eating when they're young, that's their food preference. Dry cat foods that have a variety of shapes are trying to hit all the different, if you were brought up on round pellets versus a triangle versus whatever. So they're both have different diet needs. And then I have a million people that just tell me they feed their dog chicken, rice, and carrots, and that's the whole meal. And I just say, you got to get it balanced. You have to make sure. And you can get consults with veterinary nutritionists. Tennessee has one over the phone, and they will make up a diet for you that is balanced, and then you can create it yourself.
So there's resources out there really for people.
A lot.
So I want to just say some of the resources you have told us about. One is called notonemorevet.com, which is great. Vet mental health. The American Veterinary Medical Association, QPR, which is Question, Persuade, and Refer, Suicide Prevention Hotline. These are all different organizations that will direct you to other organizations, or if you need help, that you can reach out to places, right? Yeah.
And I mean, I do not have children, so unfortunately, my work-life balance is really not great. It's like 90% work, 10% life, but it's hard because you can't be off, and then somebody whose pet you've been taking care of for 15 years, they contact that day when you're off and say, oh, my dog's in really bad distress, or my cat's breathing funny, and you can't just ignore it because it's your day off. It's really hard. Getting back to debt, I wanted to talk about the person who owes $500,000 that I work with. When you graduate, apparently there's two choices now. One choice is that you can start repaying it right away. And for a lot of vets, that could be $4,000 to $5,000 a month. And the average starting salary is $80,000. So pretty much it would eat up their entire paycheck and they wouldn't be able to live. So a lot of them do income-based repayment, and a salary adjustment is made, and they pay what, maybe $1,200, $1,600 a month, but the interest keeps accruing. So they're paying, but the debt is getting higher. And at the end of 20 years, the debt is forgiven, but they owe taxes on all the interest. So they might have $300,000 interest that hasn't been paid, and they need to come up with $60,000, 20% at the end of this time to pay this, which is a huge debt. And to do this, you have to accept the interest, which is federal and is 6%. You can't go shopping around for lower interest rates. So it is horrific financially for veterinarians. And it is a huge emotional toll, and it is nonstop, work. I mean, I love it. I wouldn't change it. There's so many positives, but I see what happens. I see women vets have children, and then they're very sad that they became a vet, and then they leave, or try to leave, or can't leave because they can't make their student loan payments without working. It's just a very, people just feel that veterinarians have a fun job and they're making a ton of money. And that totally is the antithesis of the truth.
It's the feeling I get is the line of business or profession that you're in is the humans don't take it seriously. It's almost like, let's just shove this under the carpet,
right,
and get rid of the animal. It's so hurtful.
Yeah.
Because I think that you are up against the same issues that lots of professions are when they come at us. I mean, I think there's doctors. I mean, I think everybody to a great degree, but I also think the fact that the salaries are not as high. And I also think that just the emotional toll that it takes. Plus, you're right. I mean, we've, in my family, we've all seen you taking phone calls from, clients at really inopportune times. And, you understand that somebody has a relationship with you about an animal that they really love. So, you're right. How can you really not care or make time for that? So there's just this other whole section, this other whole thing that goes along with the debt, basically. So, this is, I guess I would say it's been really enlightening to me, because some of these things I didn't realize at all. And now I really do. And I think that it will be enlightening for a lot of people too, actually. Yeah.
Right. And I wanted to get back to two things. One of them, pain. Pretty much everyone who owns a cat does not realize that when their cat is older, they are experiencing arthritis. And again, you get that, well, my cat doesn't seem sore, but I just ask people to be more willing to realize that the older pet does have arthritis, and there are things you can do to make their life much better. And that is something to be pursued. The other thing is that with the Fear Free, I can't tell you the number of clients. I try to say, if a fearful dog comes in and they urinate or they defecate, that is the equivalent to you being so afraid that you urinate in your pants. So you got to be pretty scared. Mm-hmm. And then frequently, my hospital is Fear Free, and we don't ever hold a pet down, do anything they wouldn't, like we will say, go home, give medication, bring them back. And a lot of the times people are receptive, but just as many times they're unreceptive, they're not happy, they don't want to give medicine, they feel that we're not doing a good job because we can't get the blood work or whatever, even if they're present and see what the pet goes through. And so it is really important to realize that medication is not a no-no or bad. It is good for animals that are so afraid that these reactions happen. Mm-hmm. And even for cats, we have a mobile service, and they went out to get blood and do a blood pressure on a cat. This is a very fearful cat. This woman, I have told her multiple times she needs to give the cat something for anxiety. They arrived at the house. The woman said, I didn't give that. My cat doesn't need it. And they said as soon as they started to take the blood pressure, the cat peed everywhere. And then when they had to get the blood, the cat was screaming and the owner was in the house, but she refused to give that medication. This
It's not fair. It's so not fair. I mean, it's so
not fair.
It's right. Think about yourself. You know, I think about when you had to experience something or go somewhere and you're apprehensive. You really
Right.
are.
Right.
And we can verbalize that to each other.
Exactly.
You know?
Exactly.
That at all. So yeah.
Yeah.
It's tough.
Well, there is so much that I have learned from you, Dr. Hoffman. I'm just in love with animals, number one. And thank you for everything that you do. And I just want to sort of say something that you have in writing, that you feel that when a patient, in this case is an animal, comes into the veterinary services from you, you make it important that that is a stress-free environment.
Exactly.
And that animal leaves feeling better than when they came in. And I think that we just, as pet owners, need to take that and, use it at home. Not only at the vet, let's use it at home. So
yeah.
May is going to be, thanks to you, I think we should call it May Hoffman Month.
I think that's great.
We are going to spend the month of May just on our fur friends and family. And thank you for just opening my eyes. And I hope it's opened a lot of people's eyes. And for those of you who are treating your animals poorly, shame fucking on you. That's got to stop. Got to stop. They feel pain. They have emotions.
They have dental disease.
They have dental disease, yes. How would you like to not eat because your mouth hurts? So, guys, thank you very much, Dr. Hoffman. We will see you again, I'm sure. Patty, as usual, thank you for co-hosting with me. And see you guys out there somewhere. Bye.
All right. Thanks a lot.